So we have a patient who comes to see us. We'll show you in a few minutes, but she has an ulceration on the left interior ankle. It's been around for a while. It's been come back for about a month, and she just recently saw a physician who put her on antibiotics. She was seen also previously and told that she had poor circulation, which didn't solve the problem of the ulcer, obviously. So usually an ulceration that's on this part of the leg is dependent on the great saphenous vein, which goes up the inside of the thigh. There's another vein that goes around the lateral leg or ankle, which is called a short saphenous vein. And if there's an ulcer here, it's usually dependent on that. But we're going to show you something that's kind of interesting because, in fact, the reflux in her short saphenous vein crosses over here. There's a connecting vein between the great saphenous and the short saphenous called the intersaphenous. So you're going to see it goes down and then just abruptly takes a right turn here. So on the ultrasound, what you're seeing here on the top of the screen is her left short saphenous vein. It's that little circle there. If I were to go up the ultrasound, you'll see it start to dive a little bit into the saphopopliteal junction right here. There's a few little nuances up here with a perforated, with not a perforated with calf sinus, but anyway, the most important is her short saphenous. So the way we tell if a vein is broken, we actually augment, that's to say, we are going to push a little bit of blood through the vein as if she was walking, and we're going to let go. So what you see here is what we call reflux. So the duration of this reflux is important. It's over half a second, which we consider abnormal. That would be 2 of these little marks here on the screen. So that's about 2 seconds. But the interesting thing is we're going to go down this vein. Now, what I'm doing here, I'm color coding movement. So anything that's going up her leg is just blue. So when you see the red, that's abnormal. I'm letting go. See the red? And I just want to show you where she has this very large intersaphenous vein. So we're going to go down, go down, go down. And you're going to see a vein take off here on the right. And that's her intersaphenous vein. And you're going to see this vein is very large. It's usually much smaller. And it's going to lead straight down into the ulceration here. And that's why she has this ulceration. So this vein needs to be treated to close this backflow coming down. And we may need to do a laser and some injections of sclerotherapy to close. That will take the pressure off. It'll allow this ulceration to close and heal and then not come back. So maybe we can get you a little picture. We haven't taken our intake pictures, but that's the physiopathological explanation. And then maybe we will take a few pictures to show you the ulceration here.